we have seen that the clotting is taking place by passing through a coagulation cascade or clotting cascade, and this is what is explained here. Now going to the coagulation, there are two types of factors are involved, and some factors are known by the name intrinsic factors, other factors are known by the name extrinsic factors. Now coming to the first one, here you can see that two types of substances are in pathways are there. One is intrinsic pathway, other one is extrinsic pathway. Sometimes they will ask you what is the difference between intrinsic pathway as well as extrinsic pathway. This pathway work together to ensure effective clot formation. That is the main aim of the different type of pathway. First to begin with, we will see intrinsic pathway. Now in the case of intrinsic pathway, earlier I have shown that there are number of clotting factors. There are 13 clotting factors are there. These clotting factors are actually proteins, and these proteins are playing an important role in the clotting, and we have earlier seen that in a stepwise manner this clotting process is actually going on. So first there are two parallel pathway, one is intrinsic pathway and other is the extrinsic pathway. So in the case of this extrinsic pathway, most of the time it is caused by some kind of external trauma. Trauma means injury and exposure of tissue factor. So if there is some kind of external injury, most of the time this extrinsic pathway will be activated. Now here this involves a number of factors. One is tissue factor and another one is factor 7. So then these factors will be activating factor 10, and that will be producing a very faster response in case there is a need for clotting. So here you can see that the main factor is the external injury or trauma is actually causing this inactivated form of factor 7 into an active form of factor 7, and that will be activating on the factor 10. And factor 10 is technically scientifically known by the Stewart factor, and factor 7 means pro-converting. So this is how. So when there is a external trauma, pro-converting will be converted into active form of pro-converting of factor 7, which will work on factor 10 or Stewart factor will be converted into active form of Stewart factor, and that will work on this prothrombin. That will be activating factor 10, and activated factor 10 will work on prothrombin and converting it into thrombin. But thrombin is the enzyme. So thrombin is the main enzyme which is responsible for converting fibrinogen into insoluble fibrin threads. So when insoluble fibrin threads are formed, the clotting process is actually taking place. For that, this enzyme is needed, known by the name thrombin, but this enzyme is normally present in the body, in the blood, in an inactive form, that is known as a prothrombin. For converting prothrombin into thrombin, this Stewart factor as well as another factor known by proaxelerin, factor 5. Proaxelerin and Stewart factor are needed. Only by their combined role, prothrombin will be converted into thrombin. And this combination of pathway is known by the name extrinsic pathway. So this is how the extrinsic pathway is actually working. Now we will see another pathway. So in the case of extrinsic pathway, the factor 7 pro-convertin is there, factor 10 Stewart factor is there. But advantage of extrinsic pathway is that very faster relief or faster clotting may be taking place. Now we will see how the another pathway known by the name intrinsic pathway. So in the case of intrinsic pathway, the intrinsic pathway mainly consists of these factors: factor 12, factor 11, factor 9 and factor 8. These are the main factors, and that will be activating the factor 10, that is a Stewart factor. We will see what are the factors which are present in the factor 12 means plasma thromboplastin antecedent, PTA, and factor 11 means The factor 12 is a Hageman factor, factor 11 is a plasma thromboplastin. So these two, 11 and 12, plasma thromboplastin antecedent, Hageman factor, then factor 9. The factor 9 again is a plasma thromboplastin component. One is PTC, other is PTA. So PTC, PTA, Hageman factor. These are some of the major factors which are involved, and then factor 8 is also the factor 8 is anti-hemophilic factor. So anti-hemophilic factor is also known by the name factor 8. So these four factors are primarily responsible for the intrinsic pathway. But in case of intrinsic pathway, this is not a faster process, very slower process. Here you can see that in case of intrinsic pathway, this is how the factor 12 to the active form of factor 12, then active form of, then it will be working on factor 11, converting into active form of factor 11, working on factor 9, converting into active form of factor 9, then that will be acting on Stewart factor or 10th factor, factor 10, which will be activated into active Stewart factor. This along with the pro-accelerant, factor 5. Factor 5 is the pro-accelerant, converting prothrombin into thrombin, and thrombin will work on fibrinogen to produce a fiber. But here you can see that only fewer steps are there. Here more steps are there. So intrinsic pathway is a longer pathway or a slower pathway, whereas extrinsic pathway is a faster pathway for giving quick response. So that is a difference between intrinsic and intrinsic pathway. Most of the time it is caused by some kind of internal damage or internal some kind of internal injury inside the blood vessel. So that is what is happening in the, so here all these are actually, here also you can see that. So internal pathway is actually controlled by internal factors, whereas external pathway is controlled by, or extrinsic pathway is controlled by external injury. Then we have a common pathway. In case of common pathway, both intrinsic and extrinsic pathways are converge at the factor 11. See here you can see that this is the intrinsic pathway, this is the extrinsic pathway. At this junction, this at the level of Stewart factor, factor 10, both pathways are actually meeting together. And what is happening is that, so factor 10, an active form of factor 10, along with the active form of factor 5, which is the pro-accelerant, that will convert prothrombin into thrombin. Thrombin is the enzyme, and thrombin will be converting fibrinogen into fibrin. And this step is, this final step is known by the name common pathway. So when we explain the blood clotting, you need to explain what is extrinsic pathway, what is intrinsic pathway, and what is the final common pathway. Then only the description of this clotting factor will be complete. Finally, the intrinsic pathway normally activated by internal factor, very slow but sustains clotting. In the case of extrinsic pathway, external trauma are mainly respond. The advantage is that rapid clotting is there. Then there is common pathway leading to thrombin generation and stable clot formation. And this is an idea about the different steps in clotting.